Hi guys, I'm Dr. Tom Dawson, and I'd like to talk to you a little bit today about folks who've been told that their child is tongue-tied, or that they need to have the frenulum under their tongue cut. Honestly, I think this is a situation that's kind of gotten out of hand, partially because it's much more easily performed now with lasers, and partially because someone has to pay for all those lasers. So to give you an idea of what's going on, there's a little piece of skin underneath your tongue that connects your tongue to the bottom of your mouth, and that's called your frenulum. In some people, it's very long and loose, and they can stick their tongue out and touch their tongue to their nose. Other folks, their frenulum may be a little shorter and tighter, and they may have trouble sticking their tongue out far enough to pass their lips. Either way, if your frenulum is long enough that you can touch your tongue to the roof of your mouth, there should not be any problems with eating or with speaking. And so, for perspective, when I first came to Austin about 30 years ago, there was no one in town that cut frenulums for the first 7 years that I was here, and all those children were able to eat and speak just fine. The 8th year that I was here, there was a new ENT that came to town, and he had been trained at a program that felt that cutting frenulums was a significant benefit to breastfeeding. And he gave some in-service lectures to the nurses in the nursery and the lactation consultants. And after that, I'd have a family come in about once every 2 months asking if I didn't think that their frenulum should be cut. The last couple of years, the procedure started to be performed with lasers, and so now it can be done for a lot more people, and it's being done in dentist's office, in lots of doctors' offices. And so now I'm asked about this procedure perhaps every 2 weeks. So we've gone from 0 to every 2 weeks just during the time of my practice. So I'm not saying that I've never seen a child that's benefited from having a frenulum cut. I certainly have. And it's certainly those where it's extremely short, there's no question there's benefit. I've had some parents tell me, even when I didn't think their frenulum was that short, that they benefited from having their frenulum cut. I think it's sometimes hard to tell, especially when we're cutting frenulums on the 3rd day and we say the breastfeeding is better on the 6th day. The 6th day is when breastfeeding gets better anyway. So it's not sure there have been great studies to show how much cutting frenulums help. So I'm not saying it's evil. I'm just saying maybe we're doing a few too many of these. As a side note, there's also a frenulum that attaches your upper lip to your upper gum. And I'll have to say, in my entire career, I've never seen a medical book that has written about this frenulum. I've had a few children that have fallen with things in their mouth and have cut it, but I've never had anyone have a problem with their frenulum being too tight. And so and yet these are being lasered on a very frequent basis now over the past couple of years. The only really advantage I can see to that would be if you want your child to be able to stick their head out the window when you're driving down the highway and have their upper lip kind of flap like your dogs will. Other than that, I really see no benefit to cutting the frenulum on your upper lip. So I just want you to think about this. Not that it's bad. The good news is it's a very low-risk procedure. And so I think in folks where you need to have it done, you don't need to worry. It's a pretty simple procedure. My concern is it is a little costly, and then maybe we're doing a few too many of them right now. So something to think about, and I hope that helps.